we're on the air. Okay, so now we have the lower extremity. And remember, the lower extremity technically includes a portion of the pelvic girdle, not the part of the pelvic girdle that is the sacrum, but the rest of the pelvic girdle is having to do with the lower extremity. Okay. There's going to be different compartments here. There's going to be 1, 2, 3 compartments. We've already done a little bit with the big model, so we'll just lightly go over this with this model. The anterior compartment innervated by the femoral nerve. Here's the femoral nerve now, and we have our navel coming across here, nerve, artery, vein of the femoral persuasion, empty space. The empty space is a potential femoral hernia. Okay, not an inguinal, but a femoral hernia. And then the lymphatics, which are not shown here. The anterior compartment is going to include just a little bit here of, well, it's hard to make out, but it is the iliopsoas. There's a little bit of pectineus right there. We do have a much more normal looking, in this model, sartorius, life size. And we have our quadriceps. Right here, there's going to be the rectus femoris. In this case, we actually get to see the intermediate, vastus intermedius. And there's the vastus medialis and the vastus lateralis. This is actually of a different innervation right here, which is the tensor fascia lata. It's actually being innervated by gluteal muscles, or nerves rather, so it sort of goes more with the gluteal group. The gluteal group actually does impinge upon the IT band, and so both from the fascia lata and from the gluteus maximus, we're going to be inserting onto the IT band. Okay, so as we come around the back side here, we can actually remove the maximus, maybe not. There it is. And we can see then, here they have a slightly different display of how this goes together because the artist had to work with what they had to work with. But so there's the gluteus medius and minimus, and then here's going to be the piriformis, which is the beginning of the lateral rotators. Remember, these are medial rotators. This is a lateral rotator. Okay, so I'm hoping that this review sort of brings all these things to mind. So with the lateral rotators, we have the 5 of them, and so from between the piriformis and the superior gemellus, we have the emerging of the nerve, sciatic nerve. Inferior gemellus is all the way down here. In between the 2 gemuli are going to be the obturator internus. Way down here is going to be, it should be a little bit more transverse in its plane, but that is quadratus femoris. It's the 5th of the lateral rotators. Okay, here's the posterior compartment. There's 3 muscles in the posterior compartment. They're innervated by the tibial nerve branch of the sciatic, and I always like to remember it from the lateral side since I'm dealing with thumbs on my lateral upper extremity. I think of down here's the biceps of the lateral hamstrings. Okay, so biceps femoris has 2 parts to it. There's a part of it that arises in common here with the ischial tuberosity. All 3 of these muscles actually do. This is going to come down and form the lateral border of the popliteal region behind the knee. And there's going to be a short head. I guess, I don't know which one I have to pull. Okay, I'll do it that way. There's a short head that arises not from the ischial tuberosity, but from the linea aspera. Okay, so a portion of it crosses the upper joint, but it's mainly going to be for flexing the knee. The other side is going to be the semitendinous and the semimembranous. They sort of lie together and form the medial border of the popliteal region. And so that comes off, and then this comes off by pulling that. And so you can see they have the branching kind of low down, which is not actually correct. It's pretty much higher up. Anyways, this big thing that's coming down is the tibial nerve, and it goes down through, and there's going to be this superficial, eventually, fibular. It's going to come out here. This is the common before we get to that branching, and there's going to be a portion of this common fibular which then goes deep, and it's going to go straight through, and it's going to take care of the anterior compartment. Before we get to that, though, we do have a medial compartment of the thigh, and so the most superficial muscle is gracilis. And then there's going to be, because this was pectineus, and because this was the adductor longus, then they actually did a little separation for you, which is not what you normally see in a cadaver, but the brevis is between this pectineus and longus. So we're calling it the adductor brevis, the adductor longus. Here's again the gracilis, and then there needs to be, how are we going to, no, that's good. Okay, so here's this nice landmark here, which gives us this hiatus. So the adductor hiatus is actually in the adductor magnus. So we know for sure that that's magnus, and so we come around here on the back and we notice that this is magnus as well.
15 seconds.
Okay, so we'll leave it at that.